Hello, my name is Samantha Light. I'm a student nurse at Cedar Crest College School of Nursing. My evidence-based practice scientific poster is focusing on my PICO question, which is among RNs in hospital settings, does working shifts greater than 10 hours impact fatigue? The significance of this problem is fatigue has been correlated with many different adverse outcomes such as medication errors, hospital-acquired infections, patient and nurse dissatisfaction on job performance, and increased rates of nursing burnout. Working greater than 10-hour shifts versus 8-hour shifts has been correlated with many different findings such as impaired cognitive functioning and slower reaction times due to the fatigue. Reaction times and cognitive functioning is imperative during the nursing workday and week due to rapid response for emergent situations. Breaks and mandatory overtimes have also been resulting in limited breaks and mandatory overtime has been resulting in fatigue, leading to multiple errors, such as, like I said, medication errors and hospital-acquired infections and dissatisfaction itself. The process of the literature search to find articles and resources specific to my PICO question, I used CINAHL, EBSCOhost, and Google Scholar. I did do an advanced search for a time frame within 2012 and 2020, and the articles had to be full articles and they had to be within the United States. I did use some keywords such as nurse fatigue, effects on shift length, and the Boolean method to incorporate the word "and" for nurse fatigue and patient outcomes. CINAHL yielded 16 articles within the PICO question criteria. 3 articles were then used specifically and founded specifically for my PICO question and were utilized. Bay and Fabry really looked at the evaluation of the effect on nurse overtime and long work hours on nurses and how it affected patients. So the results, working more than 40 hours definitely adversely influenced nurses' role in the cognitive functioning that ultimately resulted in decreased satisfaction from the patient's evaluation and patient adverse outcomes. So some recommendations were put in place from them was stricter policies and control over mandatory overtime and long consecutive work length to improve the patient outcomes. Han et al. Really assessed the work associated factors and non-work associated factors on the impact of fatigue that can affect nurses working greater than 12 hours. The results were looking at nursing fatigue threatened both the nurse and the patient safety because an increased rate in needle sticks were found with an increase when there was an increase in work shift length. And then Witkowski-Stimfel really assessed the significance on long shift weeks and hours on the nurses and the resulting in fatigue and the satisfaction of their job. The findings for this one was that there was a increased rate of an intention to leave and burnout rates with resulting from fatigue because of the long hours. Some recommendations found were policies needed to be reviewed on the consecutive work hours and mandatory overtime to reduce the fatigue rates to try to improve the job satisfaction and the outcomes. Also, promotion of adequate sleep hygiene should be advised, so maybe even a pamphlet or just a recognition on how important sleep is to improve the cognitive functioning, and that can improve satisfaction of not only the patient, but the nurse itself. Also, supportive work environments, making sure that nurses are helping each other and patient care assistants are helping to ensure that they do get a 10-minute personal time or they're able to take a break so it reduces the risk of fatigue. Also, utilizing 8-hour shifts may be recommended in order to promote a longer work week, yet it will improve the risk of fatigue and promote more of a recovery time. Conclusion of the articles and resources found were rates of fatigue have significantly increased as the shift of length has increased. As shift length increases, a greater than 10 hours, the rate of fatigue, medication errors, patient and nurse dissatisfaction, needle sticks, and nursing burnout rates increased. 12-hour shifts are still utilized within the U.S. and they're preferred due to the impact of the compact work week with a greater weekend for themselves, yet the risk of fatigue is significant with working greater than 12 to 10 hours. And then those were my references. All right, thank you so much.